Hello and welcome to the March issue of Aesthetic Surgery Journal. Before I go through my suggested articles, I encourage you to read the journal cover to cover, which is what I always do. My first two selections are both from the breast section. The first by Dr. Mark Clemens and Dr. Hurwitz on ALCL. ALCL, fortunately, is very rare. Our understanding of the etiology is evolving. In this paper, they discuss the guidelines for diagnosis and treatment of this unusual and rare condition associated with breast implants. I believe you will find their guidelines very useful should you come across a patient with suspected ALCL. The second paper, also from the breast section, deals with a little more common problem. The shaped implants are becoming very popular, and one of the concerns is the rotation of the anatomical implants. In this article by Dr. Bill Adams and his colleagues from Dallas, they describe the use of high-intensity ultrasound to detect rotations in the implant. They point out that this is far easier and much better tolerated by patients rather than an MRI. Dr. Brad Bengtson has an excellent discussion of this article, putting all of this in perspective. The third selection is from the genital rejuvenation section, a very fast-growing area of aesthetic surgery. Miss Gemma Sharp and her colleagues from Australia look at the psychological outcomes of labiaplasty. We all assume that these procedures are beneficial to the patients, but here we have it clearly described, and the excellent commentary on this paper by Dr. Goodman puts it all in perspective. The final paper is from the research section. Dr. Greg Evans and his colleagues from California look at burnout in plastic surgeons, and this is very topical. I'm sure all of us have come across colleagues, even our trainees, who have had some issues and approach what we call burnout. There's an excellent discussion by Dr. Barry Noon, the past director of the American Board of Plastic Surgery. And given the importance of this subject, although I try not to pick my own papers or my own editorials, I have also added my thoughts on this topic of burnout in an editorial entitled "Where Love Is Not Enough." I will look forward to speaking with you again for the April issue, and by then the entire country will be in springtime, not just those of us fortunate enough to live in the South.